The House and Homeland Security Subcommittee held a hearing on the opioid crisis in relation to the United States having an unsecure border.
Reporter Emily Richardson attended the hearing to see what the state of Arizona is doing to combat the crisis.
Governor Ducey testified at the hearing today, only one day after he ended the formal emergency public health declaration he issued last year because of opioid addiction and overdoses.
We have certainly made progress, but we know that the fight remains deadly and that it is far from over.
According to Governor Ducey, that progress includes policy initiatives in the Arizona Opioid Epidemic Act, like improving access to treatment, enhancing medical education for all professions that prescribe or dispense opioids, and enacting a Good Samaritan law. However, in Arizona, more than 1,200 deaths during the past year are suspected to be opioid-related. Congresswoman Martha McSally believes part of the problem lies with the country's unsecured borders.
The overwhelming majority of drugs, maybe as high as 90%, that enter our country come through the nation's ports of entry. In order to mitigate these illicit pathways, we must secure the border and strengthen our postal system.
Another concern is that China is producing fentanyl in large quantities and smuggling it into the U.S. through the postal system. But McSally says law enforcement and border security will never be enough to end the opioid crisis.
We cannot enforce our way out of this problem. We must also tackle the crisis with treatment and recovery options that help restore individuals to health and break the cycle of addiction.
Governor Ducey also recommended an almost $3 million expansion of the Arizona Border Strike Force in the state's annual budget to help detect and deter drug smuggling. In the Broadcast Center, Emily Richardson, Cronkite News.